Hello, I'm Dr. Terrence O'Malley, Medical Director for Non-Acute Care Services at Partners Healthcare in Boston. And I'd like to go over how we selected our evaluation process for Project Impact, Improving Massachusetts Post-Acute Care Transfers. We used three principles when we decided on our evaluation design. The first was that this was a process improvement and quality improvement project and not a research project. And so we're not worried about control groups. What we wanted was that each facility over the long run of this project would serve as its own control, and it would improve its performance against its own baseline. The second was that we had to have this evaluation process extend broadly across utilization, adoption, quality, but also on the impact of these changes on the quality and cost of care. And then finally, the evaluation process had to be integrated, embedded within the transfer of information process as well. And we wanted to keep surveys to a minimum. So those were our design principles. And on the next slide, we used the following thinking when pulling these parts of our project together. We have one circle, which is the adoption of health information exchange and the universal transfer form. The second circle is that having adopted it and starting to use it, you now make it 100% of the time on all patients. That's improving the use of UTF. And those two attributes together combine to have the impact on cost and adverse outcomes for patients. So that is how we're pulling the three parts of our evaluation together. On the next slide is just a graphic of how the adoption and improvement of the UTF works. You start with building the capability to transmit the UTF. You then add the capability of identifying and finding the elements that are part of it. And then gradually you extend that capability to more and more staff and more transitions until the area enclosed by this, within this little triangle, increases until it's 100% of the time for 100% of the patients with 100% of the elements. Once you have this platform in place, you'll be able to compare the impact of improving transition and transmission of information as the rollout of health information exchange and UTF continue. Measure that impact on the utilization of medical resources, the costs of care, and finally on the adverse events that patients suffer, such as readmission or return to the emergency room. And throughout this period, we're going to be surveying receivers and senders and asking them for their continuous feedback about which elements in the UTF should be retained, which should be added, and which should be dropped, so that the UTF becomes an evolving document reflective of the changing patient care environment.